Welcome to Table Talk, the podcast series where clinical experience informs optimal human function.
Patrick Gauthier, ex-military, practicing osteopath and expert human anatomist, is here to discuss his experience working in the US Navy and Marine Corps and his extensive anatomical knowledge. He's with us today to share how this has fed his current healthcare practices. So thank you for being with us today, Patrick.
Oh, thank you for having me. It's really excited to be here.
Good. So, to kind of crack us off, I would like you to talk about what drew you to osteopathy as a career path.
Well, that's actually a really interesting question. Do you want the short version or the longer version?
Give us whatever version you would like. We've got all the time in the world.
All right, yeah, fair enough. Well, when I got out of the military, I came up in military healthcare. I joined when I was really young, and so that's all I knew, really. And in military healthcare, everything is free for the patient, and so, all the decision making is based on what's best for the patient care, right? And you have good resources, et cetera, available, mostly anyway. And so when I got out the military and I started working in civilian healthcare in the U.S., it was like a shock, in the sense that everything at all levels was based around, there was this undercurrent of how do you make money from it, And it really shocked me. And I think people weren't aware of it, but I was, because coming from outside looking in type thing, And I was working in different hospitals as a contract worker, just kind of wandering around the U.S. working in different hospitals. And I would see things like, for example, we would get together with, osteopaths and medical doctors and nurses and everything else, and myself as a wound care nurse, effectively. We would get together and we would talk about cases, and sometimes it would come up, do they have insurance, how much insurance they have left, et cetera, and it was a bit sketchy, and I didn't really like a lot of that, but I dealt with it. And then finally I hit this crisis point, right, to where I was on the edge of actually getting promoted and kind of making sort of wound care my career. And then I met this firefighter. And he was type 1 diabetic and had an ulcer on the bottom of his foot that was sort of non-healing, right? He had trouble healing it. And so it put him out of work for a little while and everything. So he was attending the wound care center. We were using all these different dressings. We were using hyperbaric oxygen therapy, all these things, and it was starting to close the wound, And he had gotten a little minor infection, but nothing major. And his insurance was running out, right? And we were all talking about his case, and they were kind of worried because the infection was there, but there's an opinion clinical opinion, we could still actually close this wound, right? But his insurance was running out, and one of the administrators was there, kind of just swooped in and was like, well, we could just go ahead and amputate. A lot of these cases end up being amputations anyway, right? And I was like, no one really said anything. I kind of piped up, and I was like, look, I don't agree with that. I think if we give him a little bit more time, I think we can close the wound, and maybe put him on a payment plan or something, talk to the insurance company. And there really wasn't much of an effort to make that happen, right? And they kind of put me off the case. They had me doing other stuff, so I wasn't really involved with it at that point. Started on the sly, right? And this was at a hospital up in Chicago. And so I leave that hospital. I haven't seen this guy. And I do my rounds at different hospitals in that area. And then I end up back there a few months later. And one of my jobs was to go and get people from the ER, and bring them up to the wound care center. And so I go and bring this guy up I go down the wound. I get a call, say there's someone down the wound care center, bring him up to someone down the A&E, bring him up to the wound care center. I go down there, and it's this guy, right? It's this firefighter who I got to know really well, And what do I see? Not only is he had an amputation, right, but it's infected with gas gangrene, right? And he's back up at the wound care center, and he's getting all this treatment and everything, emergency care and all this stuff, and I'm talking to this guy, and effectively what happened, they didn't tell him all of the story, what options he actually had. He wasn't really able to make an informed decision on his care, And so, not only that, but his insurance ran out. And so afterwards, he didn't get any aftercare. So when you amputate, you don't get aftercare. It's a high risk of infection. Plus, you take someone who is, functioning as a firefighter, a key member of society, and then you take them out of that role and put them on effectively benefits, through no real informed choice of their own, and it was wrong, man. And so I went home, had one of those moments, like where you're like looking in the mirror and you're like, what are you doing? And all that. It wasn't that dramatic. It was like brushing my teeth, and I'm like, in my mind, I play it back and I'm like looking in the mirror screaming, why are you here? But like actually what really happened is I'm just brushing my teeth thinking, yeah, nah, this ain't for me anymore, And so I was going to get out of healthcare completely. I had this brief period where I was like, maybe I should be a pilot or something, but I'm like scared of flying. And so oddly enough, in that weird transition period, I was kind of wandering around the U.S. working and stuff, and I found a book at a secondhand bookstore. I collect like antique books as a hobby, and it was called Osteopathy in Britain. It was written by Martin Collins. I don't know if you guys ever met him. And I read that book. I got really inspired. I basically sold all my stuff and came to the UK, a little bit of money and a bag of clothes, and with my knowledge and background, and then I decided to become an osteopath, and I felt like the main thing for that decision is that, the NHS, when I learned about the NHS, that was really profound for me, and it kind of really made me feel like there were options in civilian healthcare that weren't what I saw in U.S. healthcare. And not all U.S. healthcare is like that, and not all healthcare practitioners are bad. It's not that. It's more of the underlying culture that makes it that way, I think. But you had the NHS, and then you had osteopathy, and I really liked the values that it put the patient first, and how strong that value was, and how much they fought for that. And why actually some of the original osteopaths came over here. When you read that book, you'll see a lot of interesting things about that, if you ever pick up that book, and I do recommend it. Osteopathy in Britain by Dr. Martin Collins. It was profound for me. And, that kind of led to my goals of why I wanted to go into education and all sorts of things. So that's a long version, sorry.
Thank you for that.
Listeners out there.
That was fascinating.
That's really fascinating and heartbreaking also for that fireman.
Yeah.
It's terrible to hear stories like this, but it has brought you to a place where hopefully you can help a whole lot more people in the way that you want to. And I was wondering if you could tell us a little bit more about your professional journey since qualifying as an osteopath in Britain.
Yeah. So I went to BCom, and I went there and I enjoyed it, and it got me it made me a really good anatomist, I felt like, And so when I was at BCom, I kind of spent a lot of time studying anatomy. That was my main thing. And I found ways, I befriended some of the anatomists at the dissection lab, and they allowed me to stay a little bit longer than probably I normally would have been able to. And I would help them out with things and stuff like that. And so basically, I would, learn a lot about anatomy that way, and I really enjoyed it and spent a lot of time doing it. And that brought my interest into anatomy itself, and why I probably ended up teaching it in the future. And then after BCom, I graduated, and I really wanted to work in osteopathic education, and that's what brought me to the UCO. And really, I think it had changed between that time of when I first came here to whenever I was graduated and came here back in 2016. And then I found an institution which was vibrant and which was really looking forward and trying to bring osteopathy into new directions. And that's what really attracted me to work here. And then actually I studied here, so I'm now an alumni of the UCO / BSO because I did my postgraduate here. And so I had a much different experience that time around, and I felt like coming here after I graduated and seeing what it had become and morphed into, I was really inspired, and that kind of led me to working here.
That's wonderful.
Yeah.
Coming back to your interest in anatomy, in what ways can practicing dissection deepen one's understanding of anatomy and also fuel your practice as an osteopath?
Now, I do get that question a lot, and I've over the years changed my opinion on that. I used to think that you had to spend, 60% of your time with anatomy to be a good osteopath, but I don't really believe that anymore. I think actually in some ways that can be detrimental. So I wouldn't want a student who wants to just be an osteopath, not an anatomist, to really follow the same journey in that way, because I think it distracts from the wider picture of what osteopathy can be. However, a good basis in anatomy is important. I think for me, whenever I was in the dissection laboratory, I really got to, in a hands-on way, see the anatomy, and I got to visualize it. It's like the difference between whenever you see anatomy in a book, you know, and you know that something's there. So I know that something's there, right? I know what's there. I can list it off to you. To where when I look at you, I can see it. Like I can see through you, and I can see the anatomy. I can see when you shake your head. I can see what muscle's moving in my mind. You know, I can visualize all that. So that helped me with that. And then it helped me to be able to teach that to people, I think is the most important thing. So I think if you want to teach anatomy, spending a lot of time in dissection is important in particular. If you want to learn anatomy for a clinical purpose, I think it's better actually to learn it in a physical way, like when you're practicing technique, for example. You know, and that's kind of how I see that. And for me to be an anatomist, it really helped to do dissection. And, you know, I had a lot of fun there. I really enjoyed it. I met a lot of interesting people. And I saw anatomy you don't normally get to see, you know, like really strange anatomical variations. I'll tell you one interesting thing, too. Have you guys ever heard of the Body Worlds exhibit?
Yes.
Yeah. So, like, if you go there, most people will go there, and they'll see the interesting anatomy and stuff like that. But if you really look at the anatomy, if you really see it, you'll find that actually in most of the full exhibits, where it's a full cadaver, there's an anatomical variation. There's a rare anatomical variation, effectively an Easter egg in each one of the exhibits. And that I think it was very much intentional, yeah. And so I went through one time by myself and actually found all of them, and it took a long time, you know. And it was slightly crazy, I guess, and obsessive, but I really enjoyed it. And I told my wife what I was doing. She's like, "Why are you spending a day doing that?" And I was like, just kind of got to, you know. It's like I saw a couple of them, and I was like, I gotta find them. You know,
go get a couple more.
Yeah. You know? So,
is that exhibition still open in London?
It closed for COVID. I don't know if it's reopened or not. I think it will because it's quite popular.
Yeah.
But
I know
yeah,
there's
we'll
a
see.
permanent one in Amsterdam, but I'm not sure whether the one's
I do
still
recommend
there.
it. It's quite fascinating.
Okay, cool.
Yeah.
A slightly more comedic question, as per se. Approximately how many cadavers have you dissected in your time?
How many times? I'd say I'd probably change the question slightly. How many times I've interacted with a cadaver or a prosection, dissection? It would be probably in the hundreds, I would say. But
that's a lot of bodies.
yeah. But you know, these things are used to their full potential from an educational purpose, because you have to really understand that these people gave so much for us to learn. You know, they gave their bodies for us to learn from, and so it's really important that that is used in a respectful way, and as many people as possible can get the benefit from that.
Yeah. Is that something that do you think you will do when your time comes? Is give your body to science like that?
Yeah, I mean, I've actually debated that question. There's a part of me who wants burial at sea from my previous career, and then a part of me says, actually, that's a bit of a waste, and I should do it. You know, I should give my body for a dissection, cross-section. So I think in the end, I'll probably decide down that line. I think that's important to sort of, I've benefited from that, and I should allow others to.
So coming back to your experience in the military, how did you become involved in that? What drew you to that? And also, how do you think that part of your life has influenced your osteopathic practice today and how you interact with people?
Well, that's interesting. So, like, again, this is going to sound like some, like, I bumbled into something type thing, but where I grew up, there's not what you'd call a lot of opportunity. It's a very sort of deprived area. I often joke with students and I say, you know, I'm like Shrek, I'm from the swamp, you know, even like a donkey basically, you know, and it's kind of true. I'm from the middle of literally nowhere, Louisiana, you know, a wonderful place culturally, but economically very, very deprived. And so really the choices were, for me growing up, it was either become you know, a farmer, a fisherman, a priest, or a criminal, you know, and so there's not much other choice there, you know, and I didn't really want to do any of those things, and so when I was very young, 16, 17, our school effectively was burnt, you know, and there was no other school available, and so I was like, well, what am I going to do, you know, I can't really, there's no jobs I want to go and do and things like that, no opportunities, so I met some Navy guys, some recruiters, and they had a great uniform. And I thought, as a 16, 17-year-old boy would think, that might get me some girls, it'll get me out of Louisiana, I'll get a job, and I was like, I should do something in healthcare. Because growing up, the only positive association I had was healthcare, in the sense that, like I didn't have anyone in my family with a degree or anything like that was a professional, and the only time I encountered really professionals was in healthcare, when I would see healthcare professionals. So that attracted me to that. And so I went in, and all they had available was a dental technician. And so I was like, sure, I'll do that. Like, teeth don't bother me, And so I became a dental tech. And then not long after that, things got a bit heavy overseas, and they needed a little less dental techs. They needed more medics, And so they volunteered me to become a medic. I was one of the early volunteers, let's say, to switch from dental technician to a medic, and then I became a medic in the Navy, and I served on an aircraft carrier, and USS Ronald Reagan, as a dental tech / medic, and then I was worked with the Marines also, and I ended up actually in London for a while, stationed in London for a little while anyway, and that's actually where I met my wife.
Oh, lovely.
Yeah, that's right.
All converging in London.
Yeah, that's right. And after I got in the military, that's another reason I think why the UK stood out as an option for me too. Yeah. But what shaped me, I guess, with military healthcare and that experience was, I got the experience of working with a department, like in a sort of mini hospital, and in big hospitals and small hospitals, small clinics. I got all those experiences. And then I got the experience of working completely independently, where I was the only person around where people could access healthcare.
Was that on USS Ronald Reagan?
That was out when I was working with the Marines, for example.
Okay. Yeah.
And so, in sort of remote places, etc. And I got the experience of actually, seeing what it could be like whenever, what you could contribute as a single person, as a single point of healthcare, versus what you could contribute as a part of a team, and the differences and benefits of both, and that really gave me a lot of confidence, both in my own abilities and the ability to train people to do things they don't think they were capable of doing effectively. If you would have taken that 16-year-old boy trying to get girls with his uniform to, working, in East Africa, where you're the only healthcare around, that I never would have thought I'd been capable of that. But if you train someone and you give them confidence, you give them some experience and mentoring, then you can really do a lot.
Yeah, that must have been one hell of a steep learning curve to be in that kind of situation where there's no choice. It's just, you have to just get
the learning
it done.
curve is definitely what it was periods of significant boredom interrupted by periods of terror, but nonetheless, I'm proud of my service, and what I did. It got to a point to where you reach a point, I guess in my sort of early 20s, where, the mission of what you're doing isn't quite what you thought it was, and you find yourself continuing based on the fact you just want to help the people around you, And so once you get to that point, it's kind of time to move on, I thought, but nonetheless, I really enjoyed it and I learned a lot. Yeah.
And how did you grow to cope with the pressure that was on you? And also, how did you build your resilience to witnessing serious injury in situations like that?
Yeah. I don't know if you can, I don't know. I can only speak from my own experiences. And I was never a born warrior, I know people. I have a good friend who's an osteopath. He was a Royal Marine. And I often tell him, he was a born warrior, I was always a scholar who just kind of stumbled into that type of life, I guess, for a short period. And, so maybe a person like that would have more resilience. I don't know. I can't tell you. But for me, I guess you just get through what's in front of you, and you focus on what you've been trained to do, and you try to do the best you can, and you always try and move forward and not just stop, I guess the resilience comes later, actually. Once you leave those environments and situations and you don't have the same support network, that's when the resilience really tests you. when I got out of the military is when I was the most scared, because I went from being effectively growing up in military and military healthcare and that world to, in my 20s, getting out. And basically, I was in a base in Norfolk, Virginia, and when it's time for you to get out, they call you in the office, they say, hand in your ID card, they give you, at the time, like $200 and say goodbye, And so you walk off the base and you can't turn around and go back because you don't have your ID card, and you have $200 in a bag of clothes, So what do you do, And so I remember just like standing outside the base and looking at the world and thinking like, okay, and I just didn't know what to do. Kind of wandered around, for a long time, trying to figure that out. And that's when the resilience comes in. I think you have to really lean on your own personal resilience at that point, And then over time, you find ways of channeling that energy, into something more positive. And so that's what I did, and I was lucky, and I was able to do that. Not everyone was able to do that.
Yeah, finding that direction after having or being in a situation where everything is planned and organized, and you've got a direction for you. You just have to execute. Yeah. So it's very similar with like professional athletes and things of that nature. Yeah. Coming back to normal life is just. Yeah,
it's those bigger things, and it's those bigger things that then like, those bigger sort of directions in life, down to the very sort of basic things of how to how to rent a place to live. Like I'd never done that before. I'd always lived on base or on the ship or something like that, or I had all that taken care of me when I lived off base, So it was all those things, Yeah.
Okay. Just referring back to your osteopathic practice, like how has that experience in the military influenced that? As in, like, have you learned to be able to manage some of the more difficult situations that you encounter in clinic?
Yeah. Well, I mean, on a very broad basis, nothing I've encountered in osteopathy so far has ever been as, I suppose, immediately challenging as what I've sometimes encountered when I was in the service. But it's a different type of challenge, I suppose, in the sense that what helped me was I'm comfortable working independently. And that's important for an osteopath, I believe. You need to have some confidence working independently. And so I'm comfortable doing that. What I like about it is that when I was working more independently in the military, I got to see people through the whole journey of care quite often. And a lot of times in healthcare, you don't get to do that. Like, you may see only a part of someone's journey. In osteopathy, you do get to do that very often. You get to see cases from start to finish, which is great, and that helped me prepare for that. And of course, with the basic skills of communicating with people, being able to read nonverbal communication is really key to being comfortable using your hands, and particularly with differential diagnosis, stuff like that. All those really core skills, I think, that help osteopaths to do well in clinic. All that prepared for it. And also, I guess, for me, there was always a really odd relationship between income and healthcare, and that was really embedded with me in the military, in the sense that I had such a strong ethical foundation. The sort of ethics of healthcare was really embedded strongly in me when I was in the military. Not in the same way we do it here. And here it's more, it's done in a way that's more, I think, professional, in the sense that it's easier for students to adopt it, and they learn it over a period of time. In the military, they kind of just make you do it. That's what I'm getting at. It's like, that was unprofessional. Do it again. You're going to the brig. Your patients may be like, a lot higher ranking than you most of the time. So there's that aspect of it too. So that taught me a way of being professional, and so all that helped when I became an osteopath. A lot of that stuff was kind of built in. I find that I do encounter veterans in the our education system, osteopathic education system here, and I find that a lot of those core skills really help them, particularly the aspects of communication and being confident in working independently as an osteopath, etc. Sometimes, as I said, what they experienced in the military, or that experience of leaving the military, presents different challenges, and sometimes those challenges can be quite hard for veterans, I think, coming into higher education. But if they can get past those challenges or find support for them, then they have a lot of really core skills that really help them to become quite good osteopaths, I think.
And talking of veterans in terms of older generations, let's say, I think you specialize in working with over 55-year-olds, is that right?
As much as any osteopath can specialize, I suppose. My area, I would call it more of an area of clinical interest, in the sense that I've worked in here at the UCO. Another reason why, I was really attracted to study here postgraduate and to work here is that the specialist clinics are great. The over 55s clinic, which is closed right now because of COVID, but I think it'll open up again once things calm down. As you can imagine, that population is quite vulnerable to that. But I had an opportunity to work with that population, and it was reminiscent to some of my experiences working in a rural healthcare. And oddly enough, even though it's in the middle of the city, because in this area, at the time I was working in that clinic, it may be different now, but the over 55s population really had trouble accessing primary health care. And so, they may have a long waiting time to see primary health care. So I got to work with them, not replacing a GP, of course, that's outside of my scope of practice, but to actually help them with all the other aspects of the care and giving them advice and helping them to seek referrals and things like that. So really getting to operate more independently and more in a preventative and supportive way as an osteopath than I may normally get to do. And I really enjoyed that.
Right, so being more of an advocate for
that's
vulnerable
right.
people.
Yeah, that's right. And helping them to manage some of those parts of care that might get missed when they don't have good access to primary care. So like, for example, they may get some imaging done and get a report, but there's no one to read it, to explain them what it actually says, or their access is limited, so they weren't able to spend a lot of time going through it with someone, So I can do that. I've been trained to read reports and talk to them about that, and so that's something I was able to do and really use that to help guide, their care for what I'm actually doing, And so that was a great experience. I just really enjoyed the experience of working with that population. I felt like there's so much we can do there, because a lot of the conditions that you encounter, normal age-related changes that become very symptomatic, like osteoarthritis, etc. Those things are ongoing quite often, and there's no easy fix for that. And so you can offer a whole range of support for that on an ongoing basis that focuses on, pain relief in the more short term, but actually really giving the patient some agency to care for themselves, to take that and say, I can actually manage this myself, And so you got there's a lot of good work we can do in that realm. And I thought that population took that on really well, and I found I can make the biggest difference there personally.
Wonderful. I think that's definitely something that osteopaths can be useful for, is really following patients and really giving them the knowledge that they can't get anywhere else, because the NHS is quite overwhelmed most of the time.
Yeah, I mean, I wouldn't say the NHS is overwhelmed. I've always had, as I said, it's one of the reasons I came to this country. But I mean, yeah, right now it might be, actually. I should say that right now because of COVID. Yeah, it probably is in many cases. But I think there's sometimes the NHS has trouble keeping up with demand in certain realms, and that might be one of them. But really, that's where we can come in, I mean, I always see myself as someone who is trying to help a patient find their own agency in managing whatever it is they have going on, whatever's limiting them to live well effectively, and so. And nothing more specific than that, I suppose. I don't see myself as someone who goes out and fixes osteoarthritis or fixes a neck or a back or something like that. It's more about actually saying, okay, going through the process of saying, hey, this person's in pain. How can I help reduce that? How can I help them understand why that happened or why that may have happened? So they can understand that, and so they can see what happened, so they don't start to develop all these sort of beliefs around, their really negative beliefs about what's happening to them and their pain and their experiences. And then how can I help them help themselves effectively? That's a long-winded way of saying, how can I help someone help themselves? And I don't see an osteopath being someone who forever treats someone using manual therapy personally. I think, manual therapy is really good And it's only a part of osteopathy. It's not osteopathy. It's only a technique that we use, and it's really good for helping someone with pain. But really, what we do is how we communicate with people, how we use education and confidence and cognitive reassurance effectively to help them reach their own agency.
That's a really inspiring point.
You may have to edit some of that because I kind of wonder a bit with my. Feel free to cut that and make it shorter.
And giving those tools to people rather than just going down the direct pharmaceutical route of trying to treat symptoms is, I find at least, so much more effective in the long term.
Yeah.
Than what our standard healthcare system kind of goes as default.
And I think that's a big part of what we're going to be doing in the future, especially. I see that as a big role for osteopathy. In a way, going back to sort of our origin, in a way, because, I mean, again, another thing that resonates with me as a veteran is that I've had lots of shipmates and fellow Marines who became, really struggled. My brother, unfortunately, also, who really struggled with opioid addiction, and so, and I've seen patients struggle with that also. And a lot of it's based around, not all of it, and I'd say some of it is based around, I think, an inability of certain aspects of our healthcare system to help manage pain, or what to do with people who are in chronic pain, and both it's sort of a developing thing here. It's blown up really bad in the U.S. And I think that's happening here, and it's going to be a big problem in the future here also. And I think we have a strong role to play in that, in the sense that we have all these tools, to help manage chronic pain and help a patient themselves manage chronic pain. And we have the most important resource is we have time. If you think about the average osteopath spends probably half an hour with their patient. That's a long time. And they'll see them, 3, 4, 5 times, maybe more, over a period of time. I think that's pretty average. And imagine what you can do in that time. Imagine if just you and I were talking, what I could teach you about,
anything.
Yeah, well, about your specific situation, about the pain, and then imagine the questions you can ask me and the time you could spend outside of that, learning about it and getting the tools. Imagine all the tools I could give you in, 5 hours, 6 hours of just us talking.
Yeah. As opposed to seeing your GP, which could be 6 to 10 minutes, and then it's done with.
Yeah, and I'd never blame the GPs for that, because their job is infinitely difficult, and the tools they have at their disposal sometimes is limited, and but that's where we come in, and I think we can really help them, and we can help reinforce the healthcare system, and we do it now, mostly privately, but I think there's a big role for us in the public health, in the NHS, to do this also. And I think the opioid, I would call it a crisis, developing opioid crisis here, is something, a big role we have to play in helping reduce that and mitigate that.
And I guess another really important tools that osteopaths have is touch, which we don't receive regularly, especially at the moment. And I was wondering if you could talk a little bit about touch deprivation. So considering that lockdown has increased that kind of, they call it an epidemic now, of touch deprivation, how has this affected your approach to patients, and has it affected their response to treatment now that touch has become a bit more rare?
Yeah, well, that's interesting. I mean, some of my colleagues may have different experiences than me. I can only speak from my own, but I haven't noticed a massive difference in how people respond to touch. I've noticed that I suppose patients are maybe at first, maybe some patients can be a little more apprehensive than they would maybe normally be, and so you just have to doubly be aware of consent and especially if it's a newer patient. Of getting people used to that idea, and to responding, most importantly, to responding to the nonverbal cues of when it's not okay, when that sort of manual therapy is not acceptable. The great thing about being an osteopath is effectively that's only really a part of our toolkit. You have loads of other things you can do when that's not okay, and so I think it's just made me more aware of being in tune with my ability to pick up on nonverbal cues in regards to that, both if that's something that a patient would benefit more from in that particular interaction or less from in that particular interaction. So it's about being more aware of it. Now, I often get asked about the gloves, and honestly, personally, I don't see much difference in using gloves, not using gloves. That may be because I used gloves in my previous career, probably a lot more. Actually, the only times I didn't use gloves was when I came over here and became an osteopath, is when I used gloves less, actually. So I don't know. So I can't speak out. Plus, as a student, I was absolutely obsessed with palpation. So I would do all these really extreme things to try and learn how to be better at palpating. I have no idea if it helped.
Can you share some of those?
Oh goodness. Okay. All right. I would blindfold myself and try and identify different objects and stuff like that. I had a friend who loaned me some Braille books, some books to teach sighted people how to read Braille. And I actually thought that was a good experience, not just for palpation, but actually because I had had patients who were legally blind, and I guess it gave me a better insight to, not a full insight, of course, but just a tiny window into their experiences too. So I basically learned Braille effectively. To read Braille at a lower level, not a very high level, but enough to where I could read basic things. To the point where I set a goal for myself in the sense that I love reading books, Star Wars books, right? I'm a massive Star Wars fan, and I read all the books. So I got a couple Star Wars books I haven't read in Braille, and then I would read them.
Wow.
And so to try and improve my palpation as a goal, but I did that as a student. That's kind of one of the things I did to give myself that experience. So I don't know. I have no idea if that helps. And I'm not saying go and do that, It's just me trying to discover as a student, as we all do as students, what works and what doesn't work. But so I don't know if the gloves made a difference or not. To me, I feel the same with the gloves and without. For me, it's important the guidelines are to wear gloves, and I think that's important to follow, because it's not only for safety reasons, even though, you could debate whether or not in the current situation, if gloves are, if they're appropriate all the time, I don't know. I personally follow guidelines. So I think there's good reasons to do so. But I think the most important thing is it projects to the patients that we are being safe and appropriate as much as you can be, as osteopaths, and that's really important. And it, I think, puts a lot of people at ease, during the current epidemic.
Yeah, I think even with, because obviously us being just finishing our first year, we've only known gloves, so it's not really too much of a problem.
Yeah,
but
that was kind of like me, I suppose. Yeah.
But I mean, as a massage therapist, I've done the same thing where I've gone and done the full PPE. So I now wear scrubs when necessary. I wear gloves and I wear a mask to cover for all of that. But I think, especially for osteopathy, which is not relatively new, but not as accredited as it should be, I don't think, in the public eye. It gives you a bit of professionality, which you didn't have before, and a bit of respect when people come into the room because you have a uniform. Yeah. Whereas before people were just wearing whatever they wanted to work, which I think it's just not very professional. Yeah. That should improve the osteopathy overall, I think.
Yeah. Yeah, I mean, I would. Again, I'm no stranger to a uniform. I like the idea of wearing a uniform. I like the idea of wearing scrubs and PPE. I think it does project an image of professionalism and a consistency. And I think that's really important. Osteopathy is an interesting place. I think of people who know us, they know us as an accredited, legitimate, great profession. We have such good responses. When you see some of the surveys that will come out of GEOSC or IO about patients' opinions of osteopathy, it's really high and it's really good. And I think that says a lot about us. There's just not as many people that know about us, And I see that changing in the future, particularly with the roles I believe we'll end up taking in the wider field of healthcare in the future. But
especially now that osteopaths are considered allied health professionals, part of the NHS, that's probably going to be really helpful.
Yeah, and I mean, that's been my secret sort of dream of when I first came over here, because I had these two, almost a dichotomy in the sense that I loved osteopathy and the ideas and the principles of it, and just the sort of underlying culture of it, of how we work with patients. And then but it was mostly private healthcare, which I have this very strong thing, where I don't really have a strong attachment to, let's say. And then you have the NHS. And so my dream has always been to align those two together, to really bring a bigger amount of osteopathy into the NHS, And so, and I see I see a good future for that.
It's a very noble quest to be going on.
And I see you mentioned Star Wars. Now, we know that you're a big fan. You mentioned it a few times this year. And we also know that you're a keen gamer. Yeah. And we were wondering if you could talk a little bit about that and how it helps you to, create a barrier with everything else that you do and just de-stress and relax.
Yeah, I mean, I have less time for it now because of, I'm a family man and I have, other pursuits and things like that. But I've always kind of been a bit of a gamer, and I guess it cemented a bit whenever I got out of the military, and I actually was gaming with some fellow veterans, and so it gave us a sense of community when we weren't in the same place, and that was good, and I guess, it was a way of whenever some of my experiences would come to the forefront and I was having difficulty managing it, kind of gave me a space, I guess is the best way to describe it, and that was good. And it is like anything, though, and moderation is important. People can really struggle with gaming addiction, and I do tell people out there who feel that they may be struggling with that to get there is help out there for you, and you should do that. I was thankfully I never reached that point with it. I was always able to keep it in its own little box, and it just used that in moderation. But I really enjoyed it. I play some MMOs. I'm a big fan of the Elder Scrolls series. Anybody likes that out there? And the Mass Effect series, except for Mass Effect Andromeda, it got more grief than what it deserved, but it wasn't the best game, but it could have been better. But that's okay. I'm sure they'll take another shot at it.
Yeah, I'm also a big fan of those survival style games where you're searching for little clues and tools and things that you can use and adapting your weapons and things like that. It's a lot of fun. Yeah,
absolutely. Yeah,
it's a lot of fun. I'm personally a big fan of using routine personally for work, and so I was just wondering whether you have any pre-work or post-work routines that you use to either switch on or switch off.
Okay. In what context? Do you mean for education or learning or
for both of those? For osteopathy, for when you come in to teach, for any of those things? Are there any particular headspaces that you like to try and get in, or tools that you use to try and get there?
Yeah. Actually, I'll take a stab at combining all of those actually together. So, and this goes with a question I get asked quite a lot, is about how to study and how to keep your knowledge base strong, particularly after you graduate. Yeah. And so one of the things that, I tell people, when you're learning things that are knowledge heavy, like anatomy or physiology, for example, it's hard to keep it in your head. You never really fully keep it. You kind of only borrow it, that knowledge, and you have to sort of keep refreshing it, like taking a book out of the library, you got to keep renewing it, So what I tell people when you're in clinic, and particularly when you're in private practice, one method of doing this is book time with yourself. So what I would do in clinic is I would book a spot in my clinic diary. I would literally book half an hour like I'm a patient, right, in the actual diary, so I'm beholden to it. And I use it because it costs time, if I don't. And so I do it once a week. And so what I would do is book half an hour, and at the end of the week, whatever that meant for me in my working pattern, and in that half hour I would take a patient case and I'd review the anatomy, the physiology around that case. I may review the self-management strategies I use with that patient, some of the education I did, and then I would spend maybe, say, 10 minutes with the knowledge base. I'd spend 10 minutes with the self-management strategies, and then I'd spend 10 minutes doing research, of the most contemporary topics I could find relevant to that case. And so that may mean for that week, I would review the anatomy of the knee. I'd review some physiology of the respiratory system and pathophysiology. I may review something to do with how I communicated with that patient and what exercises I might advise them and how I tried to get them to actually do the exercises. And then I might read a research paper regarding whatever it is that presentation was about. And so that means that literally 52 times a year, or well, if I took holiday, say 50 times a year, I was spending half an hour reading and learning about all aspects, as many aspects as I could, relevant to that patient population I'm actually seeing. You know, because what people struggle with and I think what people tend to struggle with is they'll say, I need to refresh my anatomy. They'll pick up an anatomy book and try to read through it. Where do I start? How do I reabsorb all this knowledge? Because effectively, you won't be able to do that. You won't be able to redo your whole 4 years of education, you know, every 4 years, you know, unless you're an educator, right? You know, like you can work in education and that helps. But, so if you do that, what you're learning is going to be relevant to you and to your patient population, and you're always going to be progressing along with your CPD, et cetera. And so I would recommend that as a bare minimum, something like that. And the thing about learning is when you read about learning theory, there's all sorts of aspects of that help you to retain information. One is you have to assign importance to it. So it has to have some sort of immediate importance to you for you to retain it well. And so if you book time with yourself, there's a financial cost to that. There's a time cost to that. There's a visual cue that you can see in your diary. You know, so all of that gives you a way of assigning importance to that knowledge and that time of acquiring that knowledge. So instead of just picking up an anatomy book at the end of the day when you're tired, you know, and you've been working and you want to go home, you're actually doing it as part of your work, and that helps you to retain that knowledge. I think that's a good process to follow, and I recommend it to people.
Yeah, that's a fascinating way of
and
going
it's great
about
CPD.
It. Is that, yeah.
That can definitely be really useful for loads of people, because I was curious about how do you maintain that knowledge base when you're, I guess, in the field working with your hands all day. How do you kind of maintain that thought process? So that's really useful. I also wanted to ask you how you personally try to avoid becoming stale in your practice and kind of constantly, I guess, reevaluate your values and your processes, and how do you go about that?
Yeah, I mean, I guess for me, being an educator and being particularly here at the UCO, like there's such a community of people I can gain access to on a daily basis, and so that helps me to stay fresh. You know, like whenever I read, you know, like sometimes I'll listen to like Dr. Thompson, Ollie's podcast, right? And I'll just be like, you know, it's profound what the things that he brings up in that podcast and the people he talks to. And then I'll actually go speak to him. I'll be able to like message him about it, you know, or something, or like, you know, I'll get access to our research department and the people who work there, you know, and who are really at the forefront of things, you know, in osteopathy. And I'll get to speak to these people one-on-one, you know, and that really puts it into context. And also down to just my colleagues, like, you know, whenever I encounter things or I lose some of the knowledge drifts away about physiology or pathophysiology or something like that, I can go speak to my colleague Dan, you know, and really sort of bring that stuff to the forefront, down to even like being around students, you know, and how you guys will challenge me and make me stay fresh with my knowledge. I guess hold me accountable to it, you know. And so like, you know, like sometimes I'll get emails from students about things that maybe I hadn't considered, you know, and then it'll stimulate me to go and look that up and learn more about it, you know, or you know, refresh my knowledge on it. And then when I'm out in practice working with colleagues, I think it's important not to become isolated as an osteopath. And it's really easy to do that, you know, particularly if you don't work, you know, in a large city or something like that. Or actually, even if you work in a city can be quite an isolating place, actually. But just to find ways of being around your fellow osteopaths, whether that's regional societies or you know, working with the IO and doing events with the Institute of Osteopathy, which is a great organization. All those things help you to stay fresh, and they're really important because just doing your CPD and doing that little process of booking an appointment yourself isn't enough. I think it's good and it's great. It kind of keeps you on top of things, but you need that community aspect, and you have to build that into what you do. Also, the networks you build as a student, those are really important. You know, some of my closest friends, I have a group of friends that we kind of came up together in osteopathy, both from my experiences at BCom and my experiences at UCO as a student. And that's really important.
Nice. That's fascinating. So you got to spend all your time learning how to be confident and work by yourself, and then be active in trying to make sure that you also don't do that.
Yeah, it's incredible. And that's the challenge of being an osteopath. You have to be a little bit of everything. I think that's why maybe it's such a challenging course, and why there's less of us out there. We're a relatively small profession for healthcare. I think that will change, but it is a challenging thing to become. But if you can meet that challenge, and I think people, it's not that you don't have to have this background of massive intellectual capacity or background. The background I came from was as modest as you can come as far as education. I remember my history book. I was in high school in the late 90s, and 99, and 99, 2000. And my history book still had the Berlin Wall up. It was so old and outdated, and I was sharing it with other students, one history book. So I come from a very modest, background in education.
And then went to teach yourself Braille.
Yeah, but I mean, it's about effort though, isn't it? It's about effort. It's about making a conscious decision that you're going to do this, and dedicating yourself to it, and then seeking help when you need it, and not trying to lone wolf it either. Reaching out to colleagues and working as groups, and those types of things. Anyone can do it if they have the desire. They really have the desire to do it.
Very cool. And going back to some of your practices, through your experience of injury and dissection, how has seeing the removal of body parts informed your ability to restore their function?
Well, I mean, it's not. I suppose I would use cross-section probably better for that. And for the cross-section is effectively where you have certain aspects of the anatomy which have been pre-prepared, and you can really examine it well and view it. And I mean, that's helped. That's helped in a way, but honestly, I can't say that's been the biggest factor. I think probably the biggest factor for me is actually learning how to do manual therapy with a mind of anatomy in the background. So the biggest factor for that hasn't been that. I can't say that it has. As much as I love that aspect of what I've learned and do, it hasn't been the biggest factor. It's been actually working in technique with colleagues, and not even in the classroom necessarily, but after I've learned the classroom aspect, going with my colleagues as students and saying, okay, let's practice, and then practicing and then talking about the anatomy while we did it, and then visualizing it in that way. That's been the biggest aspect. And I think that's really reachable for everyone. And I have to say, if I'm being 100% honest, as much as I want to say and agree with you, yeah, it's the dissection and cross-section that's done it. I can't say it has been. It's been that. It's been the process of working with my colleagues. I had a colleague who I worked with at in my undergraduate at BCom, named Daniela, and we practice obsessively. She's an osteopath. She's a great osteopath. And we practice obsessively technique and stuff like that. We wanted to learn everything. And I found out at a point we weren't just practicing the technique. We were practicing it gave us a window to practice our communication skills, to practice visualizing our anatomy and understanding how the physiology, etc., connects with the patient experience and all of that. So it's those wider things. It's sort of like that aspect of that technique practice, that manual therapy practice, gave us a window into everything else.
Yes, that technique practice also gives you a level of confidence that you just cannot get anywhere else. Once you've put layers and hours over doing that, then it becomes second nature, and you can apply it so much easier.
And there's a benefit to that, and there's a downside to that, in the sense that we often, and sometimes I think we may see ourselves as only manual therapy, osteopathy is manual therapy. I don't see it that way. You'll see it in job advertisements for osteopaths. They'll say, we want a structural osteopath, or something like that. And that may mean something different to that person. But to me, that's like seeing the manual therapy and even the anatomy is what osteopathy is. But it's not, I don't think. I think that's a tool, and it gives you a window into helping a patient reach agency and self-management. It gives you a window, some pain relief, etc. And as a student, it helps you to learn all these other aspects of what you have to learn to be an osteopath that we talked about. But it's only that. It's a tool, an important tool, but a tool. I think what makes an actual osteopath is the way you approach patient care. It's your approach to patient care. I'm of a belief you can actually take any set of tools and make them osteopathy. You can apply any set of tools to osteopathy if you learn how to do them. It's about how you approach a patient and your goals and your core beliefs about what you want as an outcome and how you collaborate with people, the time you take. I think there's all of that. That's the bigger aspect of osteopathy that I see. It's that, and it's also that underlying culture and positivity we have. You won't find that on the internet so much, but the internet's a bit of a crazy place, isn't it? Sometimes I'll go on the osteopathy forums and I'm like pulling my hair out. I'm like, come on, guys, But actually, when you meet osteopaths one-on-one and you meet us as individuals and you meet our patients and stuff like that, you'll see that there's this underlying positivity and this underlying sort of drive for just helping people, helping reduce the amount of pain and misunderstanding and disability in the world, And so I think that's what osteopathy really is. And that can morph into lots of different things. It's not reliant solely on manual therapy. That's just a tool, an important tool, but it's a tool.
Cool.
That's a really fascinating point. And coming back to your more general journey, are there any mistakes that you'd be comfortable sharing with us today that you've made that you think possibly younger osteopaths or even just other experienced osteopaths it would be useful for them to know?
Oh, yeah. I mean, first and foremost, I guess, I don't know. That's a tough one. So, I have loads of mistakes, I think I'll start with anatomy. That's kind of my core thing. I thought learning anatomy as in-depth as I did and spending as much time as I did, both in undergraduate and postgraduate, and dissection, prosection, things like that, would make me a better osteopath. I don't think it necessarily did. It made me a better educator. It made me a better anatomist, an anatomy lecturer, for example. But I don't think it made me that much better as an osteopath. I think even if I didn't have that experience and I just learned anatomy in a more traditional way, more sort of normal way, I would have been the same clinically as I am now, really, at the same clinical level. So I think I spent a lot of time on that at the cost, maybe, of learning a bit more about, say, pain science, for example, a bit more about teaching self-management strategies to patients and helping a patient really, come on board with what's happening, all that communication. There's a paper I read. It's you guys, maybe if you could look up this afterwards and give the proper reference for it, because I'm just kind of going off the top of my head. It's called Affective versus Cognitive Reassurance. And that paper really was profound about highlighting all the mistakes I've made and the things I felt like I should have learned.
Yeah, we'll put the reference for that in the comments below this post.
Yeah, and then when I read Stephen Tyreman's work, also, about agency and capacity and things like that, and about how to approach patient care in a more holistic way, truly holistic way, in a way that gives someone the ability to help themselves, and to actually and takes it from me being at the forefront of the patient care relationship, patient practitioner relationship, to me being almost someone guiding the person, but not at the forefront, actually really making it about them, and that was a big change. I wish I would have spent more time with that. I have now, of course, but in my undergraduate, that would have really helped me coming out. I think that's probably a big aspect of what I did, and also I tried to this kind of shifting gears a little bit. I tried really hard to go in, but right before I was going into education, I really was keen to work in the NHS, as an osteopath, and I got some interviews, but I approached it from the point of view of an osteopathic culture, and I didn't really take time to learn about the NHS culture. And that I finally ended up getting, after several tries, got a job offer. At the same time as I got a job offer to work here, and I chose to work here instead. But so that was one of those ironic things. But I wish I would have spent more time learning about that and learning that actually, for us to get into that NHS world, we have to adapt somewhat to the NHS culture, at least at first, until we can bring some more of our ideas into that environment. And so that's probably one of the mistakes I made too.
I think I need to double check this, but I think the NHS have started to take on people as MSK specialists or MSK practitioners for musculoskeletal practitioners, as opposed to osteopath, physiotherapist, and all that, kind of bunch them into one group, which I think I quite like the idea of, if everyone can take bits from each other and learn from each other in that respect, as opposed to being segregated and we're the osteos, you're the physios, you're the whatever, and we can separate it. I think we can learn some very valuable things from each other.
Yeah, I mean, that's a really contemporary area of practice, in the sense that the Institute of Osteopathy, especially, and I'm going to put a shout out to Matthew Rogers there, if he ever hears this. But they've done so much good work about getting osteopaths into the NHS and mentoring osteopaths into that, getting into the NHS culture and interview techniques and stuff like that. All the mistakes I made before, they're really helping people with that. And I mean, my dream is that the future of osteopathy, in a perfect world, according to Patrick, right, is that where you have, like half of our profession goes into the NHS and half of it stays private, and that really benefits everyone. Because if we truly have something to offer, the public and society, which I think we do, I think it's almost unfair and it's almost unethical that we don't offer it free at the point of service. And we can't do that in private healthcare. It's just not compatible, because if you're working as a private osteopath, you have to eat, you have to pay your rent and pay your mortgage, so you have no choice. You have to charge people. And I think that if we had an option, a clear, well-trodden path for us to take our skills into the NHS, I think that's the only way forward, even from just a basic ethical point of view. There's a podcast, like I mentioned, the Words Matter podcast that Dr. Oliver Thompson puts out. It is, and he talked about the. There's one of them, and I'll have you have to again pop the reference in there, where he was interviewing David Nichols, I think his name was, about this. And it's sort of like, once you realize this fact, once you realize that actually what you have to offer is important and it should be available to everyone, you can't really go back. You can't like unsee that or unthink that, And so I'm at that point where, a big part of what I want to do is to make that a reality, and that's not opinion I think that's fully shared throughout the profession, but I think there is a large number of people in our profession and students who want to see a similar thing, And so what you'll see right now is that you'll have jobs available that are being advertised. There's a couple right now as we speak for osteopaths to work in community settings, effectively as musculoskeletal therapists, and us as listed as osteopaths. You can practice as an osteopath, probably slightly differently, but nonetheless, I think the core of what you do is still there. And also as first contact practitioners, I have a couple colleagues who are doing that now. As a matter of fact, Barry Kleinberg, he was a lecturer here. He's working as first contact practitioner, and what a great job for an osteopath. It really hones in on our core capabilities and skills of what we can offer, the patient population. And so that's my goal, and that's probably one of the reasons why I'm in education and why I want to go into keep developing my career in education to make that a reality for students.
Nice. It's very very impressive of you to be leading osteopathy from the front, teaching those who are coming up and directing it in such a noble pathway.
No, well, I mean, I'm a small part of a bigger drive for that. I rewrote the professionalism unit a few years ago, and the whole goal with that unit here at the UCO, again, it's why I love this institution, in the sense that they give these things a platform, and it's such a contemporary institution in the sense that, when I went to management senior management, and I said, these are my ideas, and I think we need to write a unit which is dedicated towards giving students an identity of being an allied health professional along with an osteopath, and helping them to prepare for the potential future working in the NHS and in private practice, and those two pathways. And they really took that on board, and they said, okay, that's great. Let's put some time in this. Let's put some investment in this, and let's make it happen. And they're still investing in it now, And so, I mean, that's my small part of that, of trying to show people that this is available to you. Because if you can see it, you can do it, right? And so that's kind of where we are with that, I think, here,
And as an experienced osteopath, what advice would you give to manual therapy students and young graduates at this stage coming fresh out of university?
I mean, I guess those would be two separate sets of advice. So students coming in, I would say, on a very basic level, don't go buy a bunch of books. Okay? You don't have to go and spend all of your money that you saved up for a university on a bunch of books. We have, all the colleges have great libraries. We have a really good one. BCom has a good one. I'm sure the rest of them have great libraries too, with all the books you're going to need. And you're going to quickly outgrow most of them. By the time you're reaching towards the end of your education, or probably even third year, or, for those on a part-time pathway, say level 5, level 6, you're going to outgrow them. You're going to be looking at contemporary research, or at least you should be, and you're going to be learning from tutors and colleagues and things like that more than you would from a book. So if you have one or two favorites, buy them, but I wouldn't buy a bunch of books. Also, I guess from a more broader perspective than that, I would say expose yourself to as much osteopathy and much healthcare as you can while you're a student. Because a big part of learning to be an osteopath and an allied health professional, most importantly, is socialization. Is socializing yourself into a profession, into a shared set of responsibilities and values. And what I talk about in professionalism classes sometimes is that the great thing about being a newer profession and a younger, more vibrant, more contemporary profession like osteopathy is that you have the ability to change it if you don't agree with certain aspects of it. So if you're, as a group of students, and you really want to see something change, you want to see something move forward or develop, you have the power to do that. So if you socialize yourself into their profession, you network with colleagues, you build yourself into regional societies, into institutions like the Institute of Osteopathy and even GOSC and the educational establishments, you can set a path and you can say, actually, I want to change this and I want to make this a big part of what we do as osteopaths in the future. You literally have the ability to do that. You sitting here can make a decision about something, stick to it, get people to back you and develop those networks and drive it forward. And that's the great thing about what we do. And I think that's why we're always going to have osteopathy, and we're always going to be a contemporary profession. And I know a lot of people wouldn't necessarily see us as a contemporary profession, but I do. I see it very much that way.
In terms of the public eye, most definitely we're a contemporary profession.
Yeah, and I think we always will be as long as people, are comfortable with bringing their ideas to the forefront and driving it forward. We have a real ability to do that in osteopathy, and you have a lot more access, I think, that you would normally have in many other professions. And that would be my advice as a prospective student, is to socialize yourself into that. And don't get discouraged if you see something you don't like in the profession or you want it to change. Do it. Be a leader, or support, if that's not your bag, support people who support your ideals, and your values. Go for it. And so for graduates, I would say don't get lost in the difficulties of the first year outside of university. It's a challenge. If you're going to go in private practice, you have to prepare to build a business. It is a business that you have to build alongside your clinical practice. Those are two different hats if you want to have your own clinic. If you're going to be an associate, which is a great way to start your profession, make sure that you value yourself and what you bring to the table. You have to be respectful to the people and understand that people who may bring you on in their clinics are your colleagues, and respect that and understand their challenges that they face running a practice. But in the end, you should value yourself, and what you can offer. And don't be afraid to try for some NHS jobs. Contact the IO; they will help you.
Okay, cool. Are you now? So you're specifically teaching and then working in the clinic here, as opposed to at other clinics elsewhere?
Yeah, and so over COVID, I've sort of worked with my own patients outside of the university. During COVID, I took a break from that, and I'm kind of returning that now, just because I wanted to focus over the sort of COVID crisis. I wanted to focus on education aspect. I felt I really needed to focus my time on getting everyone through, through this, from an educational point of view. And so I'm returning to practice. I practiced over that time somewhat, but it was less than I would normally have done.
Okay, cool.
Yeah.
Well, I'm pretty happy with that. I think that went absolutely fantastically.
Okay.
Thank you very much for coming. And it's been a real pleasure to talk to you. You've shared loads of valuable things that I think all of us can use and learn from, and some valuable experiences which you've clearly taken into your practice, and I think that all of us can really learn from. So thank you very much for coming.
Okay, thank you very much. It was great to be here.
Yeah. And if you've got anything that you particularly want to plug, any particular people, any places that you work, or anything like that, then feel free to share it.
Yeah, there's a couple people I would actually. So I think from first off is Dr. Martin Collins. The work he's done for osteopathy has been profound. And the book he wrote really, brought me here. And I actually got an opportunity to meet him and hang out with him for a little while, and that was pretty cool. I really enjoyed that, and work with him a little bit too, which was awesome. And I would probably just like to sort of put a plug in for the course team here, the people who work here at the UCO, because when I started working, I was an outsider coming in a sense that, like, I didn't take my undergraduate education here, but when I started to work here, I really felt like a part of it, and then I'm glad I did my postgraduate here. I really enjoyed it, and I like the program. I like the undergraduate program we offer here. It's, I think, truly something contemporary and something that will help bring osteopathy into the future. And so I just kind of want to plug that, I suppose. All of my colleagues.
Yeah, and lastly, we would just like to thank UCO for allowing us to use their premises to record this episode.
And we will see you on the next episode of Table Talk.